So, the topic that I have is using antibiotics when treating periodontal disease. So, the definition of antibiotics is a medicine that inhibits the growth of or destroys microorganisms. So, they are designed to kill bacteria, preserve gum tissue, and even prevent tooth loss. Antibiotics have been shown to relieve a variety of conditions. These include things like acute periodontal infection, refractory periodontal disease, and even aggressive periodontitis. Antibiotics can be delivered both systemically or locally, so either in the pill form or as a topical gel applied directly into a gingival pocket where an infectious area is present. There is compelling evidence that adjunctive antibiotic treatment frequently results in a more favorable clinical response than mechanical therapy alone. Indeed, several authors have reported success in the treatment of aggressive periodontitis using antibiotics as adjunct to standard therapy. So when we're treating periodontal disease, there's three main goals. So they are to eliminate pathogens, halting disease progression, and return the patient back to good dental health. These three goals can best be achieved with mechanical therapy and antibiotic treatment working hand in hand. So antibiotics taken orally can help treat periodontal disease by reducing inflammation and killing bacteria. Due to the fact that they're taken orally, they're ingested, which then affects the whole body, the whole system. It's systemic. Because it affects the whole body, this type of antibiotic is used and prescribed to patients with periodontal disease under certain circumstances. Its use is more limited. The aim of systemic antibiotics is to reinforce mechanical periodontal treatment as well as to support the host defense system in overcoming the infection by killing pathogens that are subgingival and remain after mechanical periodontal therapy. They also provide the immune system with great support in reducing the subgingival pathogens. Patients who regularly visit their dental hygienist for a routine cleaning and do their part at home but still exhibit attachment loss are great candidates for systemic antibiotics. Patients who present with localized aggressive periodontitis that is caught early have a great prognosis when treated with systemic antibiotics and good daily home care. It is also known that not one single antibiotic at concentration in the body fluid that can target and destroy all pathogens, periodontal pathogens. Because of this, sometimes a few different antibiotics may be prescribed at one time to the patient so that that desired outcome can be reached. A few antibiotics taken orally include things like amoxicillin, tetracycline, and metronidazole. Tetracycline antibiotics are designed to soothe inflammation and block a protein known as collagenase. Collagenase destroys connective tissues that keep teeth rooted in the mouth, meaning it stops or slows down tissue destruction and aids in bone regeneration. It also can concentrate in the periodontal tissue and inhibit the growth of acetomicomitins. So then metronidazole are usually paired with amoxicillin or tetracycline because it is not the drug of choice when fighting off or treating acetomicomitin infections. However, when it is combined with other antibiotics, it is very effective. It's designed to combat severe or chronic oral infections by reducing inflammation and bacterial proliferation. Metronidazole alone are very effective at targeting anaerobes. Although patients who present with gingivitis or stable adult periodontitis typically respond well to mechanical periodontal therapy, this means that these type of patients have little or no benefit from taking systemic antibiotics. Local antibiotics are designed to effectively target the infected area. It has been found that a local delivered antibiotic placed after root scaling and planing procedure is one of the most effective ways to treat gum disease. The primary advantage is that smaller doses of topical agents can be delivered inside the pocket, avoiding the side effects of systemic antibacterial agents, while increasing the exposure of target microorganisms to higher concentrations and therefore more therapeutic levels of the medication. So these are slow-released antibiotics that are subgingival. These include things like monocycline, doxycycline, chlorhexidine, and tetracycline. So one form, and probably the most known form of a local antibiotic, is Arrestin. Arrestin contains monocycline, so each deposit of Arrestin contains 1 milligram of concentrated, locally applied antibiotic that remains active in the pocket for an extended period of time to reduce the pocket depth. The microspheres release antibiotics over time, targeting bacteria to reduce pocket depth so gums can heal better than with scaling and root planing alone. When used with scaling and root planing, studies have shown significant improved periodontal depths. Arrestin is placed at the base of the periodontal pocket with the use of a cannula. It is in a powder form, and then once it is placed into that pocket, it adheres to the walls and then continues to fight off and kill bacteria in the pocket for 14 to 21 days. It's slow-releasing, localized antibiotic. When Arrestin is placed in the periodontally involved patient, it is very important that home care instructions are given, post-op instructions. The patient should be instructed and shown exactly where the Arrestin was placed and told not to floss or use a water pick in that area for 10 to 14 days. And brushing in that area should also just be very light. This allows the Arrestin to stay in the pocket as long as possible and to continue to fight off and kill the bacteria so that they can gain as much gingival attachment back as possible. It also has a waiting period of 3 months before it can be placed in that same gingival pocket or periodontal pocket again. Arrestin is currently the leading locally administered antibiotic for treating periodontitis. So a few other types of antibiotics that can be placed locally are Atrodox or PerioChip. These are great alternatives if the patient can't have Arrestin due to tetracycline allergy. Atrodox is doxycycline hyclate 10%. It starts out as a liquid and then turns into a gel as it comes into contact with saliva and moisture. Much like Arrestin, it is placed into the base of the periodontal pocket. Atrodox has a controlled release of the drug for up to 7 days. It's a 2-part system. So syringe A would contain Atrogel, and while syringe B would contain the doxycycline, and then you would have to connect the 2 syringes together and then push all of the liquid from syringe A into syringe B, and then from B back to A, and just that back and forth. After 100 mixing cycles, the product is ready to go. So this would take about 1 mix per second. So Atrodox also has a waiting period. This one is 4 months before it can be placed in that periodontal pocket again. In some cases, because Atrodox requires mixing, this type of antibiotic would not be the one of choice if needed immediate application. PerioChip is another one. It contains chlorhexidine gluconate. It's a thin, small, rectangular chip that gets placed subgingival at the base of a 5 millimeter or greater periodontal pocket. It weighs about 6.9 milligrams and is biodegradable, and it's placed by either the dentist or dental hygienist using forceps. The pocket should be isolated and the surrounding area dried before the chip is inserted, and then it's actually left in the pocket. 8 different sites may be treated at one single visit, and then again in 3 months or as seen fit by the hygienist. The PerioChip naturally dissolves in 7 to 10 days, and then a few side effects were noted with the PerioChip: toothaches, headaches, and even upper respiratory tract infections. The majority of the pain was first felt within the first week of the placement of the PerioChip. So overall, antibiotics play a very important role in dentistry. They are a great aid to help the dentist or dental hygienist to reach that desired outcome or goal when treating periodontal disease. Thanks.